Welcome back to Aesthetics Magazine. Find more skincare resources at aestheticsmagazine.com. In today's episode, we will be discussing body treatments. Preparing the client for a body treatment. At the beginning of the treatment appointment, the esthetician should show the client to the treatment room and provide a few minutes of privacy so the client can disrobe and settle onto the treatment table. Before the esthetician re-enters the room, the client should be instructed to communicate any discomfort or questions and to let the esthetician know if he or she becomes too warm or cool during the treatment. This is also a good time to perform a quick visual analysis of the client's skin to see if there are any areas of concern that the esthetician should be aware of. For example, the esthetician should note any moles, lesions, or rashes on the skin. He or she should ask the client about any specific areas of concern on the body, and also inquire if the client is seeking a particular result from the treatment, such as relaxation or relief from muscle stiffness. This information should also be recorded in the client's file. It is very important that the client be properly draped during the body treatment to ensure the client's privacy and comfort and to maintain a professional treatment environment. Throughout the body treatment, the client's body should be covered except for the specific area the esthetician is working on at that time. Well-placed draping can give the client a sense of security and comfort and help the client to relax. In addition, it helps the esthetician to maintain a treatment flow where the client, draped area, and esthetician's motions are coordinated. As the client disrobes and prepares for the treatment, the esthetician should make sure that he or she is appropriately draped so that his or her body is covered. Safety precautions and contraindications. Safety precautions are steps that are taken to protect clients from injuries and accidents and to ensure a safe and comfortable treatment, whereas contraindications are conditions that make a particular treatment or service inadvisable. Prior to a client's first body treatment, an esthetician is required to perform a patch test to check for allergic skin reaction to the body treatment product to be used. A patch test involves applying a small amount of the product to a very limited area, such as the inside of the ankle, and then covering it with gauze or plastic wrap for 24 to 48 hours. During this time, the esthetician is responsible to check the spot on the skin to see if there are any visible reactions like redness, itching, swelling, or other signs of skin irritation. If any of these signs occur, the treatment should not be performed on the client. Clients should complete a thorough consultation form which includes contraindications to the service, allergies, medication, previous medical treatments or surgeries, previous cosmetic treatments, skin characteristics, home care products and habits, water consumption, physical activities. If the client is pregnant or breastfeeding, real age and date of birth, last menstruation period for females, the professional that recommended the service, and any other notes that are relevant to the service. It is important for the esthetician to read and analyze the form properly before every treatment, because information provided by the client may change from one appointment to another. A verbal consultation on the day of the appointment should also be conducted to ensure that all information provided previously is up to date and accurate. For some treatments, a written and signed medical consent from the client's medical doctor may be required, especially when the treatment may have potential risks on the client due to certain health conditions. An example of such treatment will be the electrotherapy treatment where there is electrical current involved. Allergies, skin disorders and diseases, open wounds and skin infections, contagious diseases, abnormal skin conditions, recent laser surgeries, recent cosmetic surgical procedures, recent scar tissue, sunburn, varicose veins, undiagnosed lumps or swelling, current fever or flu, recent fractures and injuries, and physical dysfunction are examples of the contraindications to body treatments, and the service should not be provided if any of these conditions exist. Treatment room setup and organization. Treatment rooms should be kept clean, attractive, and peaceful. Adherence to strict hygiene procedures in treatment room setup ensures that client safety and your safety are maintained at all times. Gloves used in treatment procedures are to be disposed of after single use. All types of waste, whether clinical or not, should be stored in appropriate containers. Hazardous waste materials should be disposed of in line with licensing regulations. Treatment rooms should be kept clean, attractive, calm, and peaceful. Adherence to strict hygiene procedures and treatment room setup ensures that client safety and your safety are maintained at all times. Gloves used in treatment procedures are to be disposed of after single use. All types of waste, whether clinical or not, should be stored in appropriate containers. Hazardous waste materials should be disposed of in line with licensing regulations. Work surfaces in treatment rooms should be smooth and easily wiped clean. Floors should be easy to clean and non-porous. It is recommended that the treatment rooms are equipped with a sink and the hot and cold water supplies. Moreover, the rooms should have adequate ventilation. Adequate space in a treatment room should be provided for storage of clean and soiled linen. The soiled linen should be stored in covered containers, and a suitable and sufficient amount of clean linen should be at hand at all times. It's time to level up your skincare product expertise. Are you confident explaining vitamins A, C, and E to your clients? Stop guessing! Get the Essential Guide by Greg Risha, Understanding Vitamins in Skincare. Get your copy today at aestheticsmagazine.com.